Good morning, guys. Welcome to my YouTube channel again. Today, I'm going to discuss very important thing for the international medical graduates. It's for all you guys from not only from Sri Lanka, India, Pakistan, Bangladesh, Bhutan, any country for that matter, who come into work as doctors in Australia, for instance, hospital doctors in Australia. And this is a very important thing for them because most of us are not aware about this sort of thing when we come in. Some may know, most of us don't know. For instance, even myself, I didn't know that there's such a thing exist until I finished 3 months of my hospital training, which is the as a HMO. This is all about first ever assessment that goes to AHPRA when you start as an international medical graduate, like like HMO or registrar, and then as a person who's having limited registration or provisional registration. I think you all aware about what limited registration and what provisional registration is about. If an international graduate come and work as HMO only with their AMC Part 1 and English qualification, they get AHPRA limited registration. Likewise, if a GP comes without having the fellowship and getting ready for the fellowship, you work as a GP in your own country and come here as a GP, and then you will also get a limited registration. So if a person is under limited registration, your supervisor is supposed to give a extensive report about your performance at the mark of 3 months period. Okay, so this is the form about AHPRA 3 months assessment. Similar to AHPRA assessment, there are other assessments done by your hospital. For instance, from my memory, like when I was HMO in Bendigo Base Hospital here in Australia, I had HMO assessment done by our consultants, like the ED consultants or medical consultants, surgical, oncology, orthopedic, pediatrics, those psychiatry, those are the units I work for. Like those assessments done by hospitals, actually every like 6 weeks, twice in 3 months. So what I'm going to cover today is like, first I will go through the AHPRA assessment. If I have time, I will go through an example of a hospital assessment. They're very similar, like they quite parallel to each other. So if you cover one, that will cover our requirement, okay? Without a lot of discussions, we will go to this assessment now, but I think it's better for me to get the AHPRA form out and then discuss it with you guys. Let's do it. Okay, so this is the AHPRA assessment. I'll make it bigger. Oh, probably not. I think this is better. So this is the AHPRA form, but I'll make it a bit bigger on my screen so that you guys can see it. Okay, so I'm sharing my screen now. So this is the form. It's called WRIG 36, I think 30, sorry, WRIG 30. It's the work performance report for international medical graduates with limited or provisional registration. And see here, it's the Medical Board of Australia or AHPRA. Completing this form, they say, okay, do it in block letters, putting an X in applicable boxes. These are just simple things for you and your supervisor. So the instruction for us, for the international medical graduate, is you should complete this form first. This enable you to identify your strengths and areas for further improvement. So we fill it first. I'm not sure whether it will happen in this way when the supervisors assess you. They probably pull out the form and then go through with it, but they will ask you to do it yourself first, and then the supervisor will have a meeting with you, and then during that meeting he or she will ask you to fill this form, and then they will then discuss it with you, and they fill it as you go, and then submit for the AHPRA. Okay, if you both agree, or if you have discussions, you can have discussions. I'll come to that when we come to the latter part of the form. Okay, so what AHPRA advice is, the IMG, you and me, we have to fill the form first. There are then appraisal criteria 1 to 5 at the top of the column. Complete the form by initiating each box which you believe best describe your performance for each statement. So there are many statements. You say how you did it. I'm competent enough, or I think I need to improve, and things like that. Okay. Then principal supervisor is your main supervisor for your rotation. Say if you do a ED rotation, I started at the ED in Bendigo Health. So if you do the ED rotation, you then discuss, fill this form with your ED consultant. Okay. If you do a medical rotation, it's with your medical supervisor. If you are a GP in training, then you do it with your senior GP. There are instructions to them as well. So they have to put this 1 to 5 ticks or cross at the box, and then they have to put the cross at the box which best describes the performance of the IMG. Okay, how they believe. They might discuss it with you to say, okay, I'm going to put this cross because your performance is like this. Then they say you may wish to seek input in the assessment form from other clinical and administrative staff, including previous supervisors and co-supervisors, and then they can put their names. This is like, I don't know whether you guys are aware, you better be aware, because if this form is pulled out by supervisor and they say, oh, you're not doing well, or you're doing well, or whatever, you should be aware that this form is filled not only by his observation. He should go through what his or her observation. He should go through actually what we call a 360 degrees assessment, which is like right around you. That means your supervisor is supposed to ask it from the nursing staff, clerical staff, co-supervisors, fellow HMOs, fellow registrars, and then your referral, like if you in the ED, how you communicate with the medical registrar, for instance, or if you refer your patients through ED to private consultants, he's supposed to check with them as well. So it's like a 360 degrees assessment. So it's not only one person's assessment, not only your immediate supervisor's sort of observation. It should be after talking to all these guys, okay, all the teams. So that's why it's called a 360 degrees assessment, including ambulance officers and patients. Very important, patients and patients' families. So he or she is supposed to get some feedback from patients and their families. They get this, even myself, I can remember some of the families wrote good letters. If you get good letters to say, oh, such and such doctor has done well on this day and something like that. So some of the patients are sort of kind enough to do that. Without even we asking, they just send email or they just send letters to the emergency department or GP practice. It happens, like people appreciate your work. So if you do well, if you kindly done a lot of things for your patient, or if they're very happy about your service, sometimes they have the courtesy of sending a thank you letter. I can remember Bendigo ED got 2 or 3 letters, 1 or 2, whatever, letters regarding my sort of, like they were happy. In the same way, they can complain about you, right? If you don't do well, don't worry, they will do that as well. So they can do that too. So anyway, what I'm trying to get at is like it's a 360-degree assessment, which your supervisor supposed to go. Then you put your family name, first name, your AHPRA registration number, MED, and assessment period from which date to which date, like 3 months. What's the position held, how many hours? Usually in Victoria, it's 38 hours per week. And then name of the hospital and practice and locations at which the IMG has been practicing. So if it's only emergency, so it's one location, but if it's a GP clinic, you might be sort of doing some aged care or covering other GP practices, so they have to mention those. Then the principal supervisor's details, their first name, family name, their registration number. If they're going to include any course supervisors, I can't remember mine whether they included, but I remember the principal supervisor, of course. And then they fill the forms, like how many months they supervised you for. So they can put 1 or 2 course supervisors too. Then describe the nature and level of supervision. I'll cover the levels of supervision in different video. Like they are like level 1, 2, 3, 4. 1 is like very close supervision. 2 is you get a bit of independence to work yourself. And likewise, we will go through that in a different video. So they have to put what level of supervision. Usually level 1 or 2. I think 2 generally. 2 or 3. Then the performance. This is what very important for you guys, because most of us are not familiar with this sort of assessment being done in our home countries. I'm not sure about the other countries. I can't recall in my time we were doing something similar in Sri Lanka, right? There may be supervisors giving reports like referees reports and things, but not like a custom made this sort of form. Anyway, this is a good thing in Australia because everything is checked. As I said, it's not only one person's view, it should be different people's view. If one person is put some ideas to you, say, oh, you're doing this way, then you can ask them back to say, have you asked the other guys? Okay, have you checked with the nurses? Have you checked with the ambulance guys? Have you checked with the medical registrars and so on? So clinical management, the first section C, this is the performance. So first the registrants or the IMG has to tick this box, put an X on whatever the suitable box, and then the supervisor. So first thing here, obtain, these are simple things, what we do, we're supposed to do day to day, but we may not be considering these things sometimes. Sorry, that's why I suggest you to go through this form. This can be sort of downloaded from the AHPRA website, or as you can remember, I gave you the form number. So if you type that in Google, you will get the form. So first thing, obtain and document a comprehensive patient history. So then you say performance consistently well above the level of expected, below the level of expected, sometimes perform below, consistently at the level of the expected or above the level of expected. So 1 is below. Sorry, I got into my language. 1 is below the required level. 2 is okay. 1, perform consistently well below, very very well below. So it's like you may not be approved for the next one. And then the 2 is below, still you won't be. And then sometimes perform below. So this is where the sort of borderline comes. And then the 4 is consistently at the level expected. 5 is consistently above the level. So you actually targeting 4 and 5. 3, your supervisor sometimes may say, it depends, depending on what they are assessing. Obtain and document a comprehensive patient history. So you will think, oh, I'm doing well, or so you tick it, but the supervisor will give you how he feels and how the other team members from that 360-degree assessment process feeling. Perform and document appropriate physical examination, similar. Yeah, like, your basic skills, history, examination. Then the critically assess information and identify its major issues, make timely and appropriate decision and act upon them, which is like, critical information. Is it urgent? Where should it go? Should I refer? Should I talk to supervisor and things like that? Are we talking to other members about information without major issues and making right decisions? Then request follow-up and interpret appropriate investigation and revises management plans as necessary. These are the things your supervisors will be keeping an eye on. Like they say, oh, he ordered this blood test. What is he going to do? Has he sort of informed me about it, like findings, and is he trying to act on that? And is he changing his management according to the findings? Say a chest pain, you think about differential diagnosis, but you do different tests, and so the X-ray suddenly found a pneumonia. Then you will change your management towards, like, antibiotics, and yeah, likewise. So that sort of process. Recognizes and manages appropriately emergencies that arise when managing patients. Like these things always happens, and then if the supervisors and yourself feel that you're doing it well, you would go for 4 and 4 or 5, usually 4. And sometimes they might think about, this is borderline. So anyway, these are the things. You actually, as I said, you actually targeting 4 and 5 in this form. Recognizes and manages appropriately emergencies that arise when managing patients, plans appropriately for the discharge of patients where relevant, including completing a discharge summary satisfactorily. So, in ED, when you send them home with GP follow-up, you're supposed to write a discharge summary to your GP. And then we always did that, I remember. And comprehensive summary with a plan, and whether you're suggesting any blood tests or whether you're suggesting further follow-up, outpatient ultrasound and things like that, and fracture clinic, those sort of follow-up plans. Then perform procedures safely and within his competence and defined scope of practice. These things like, catheters, cannulas, lines, like arterial lines, or like, blood gas, anything like plasters, those sort of procedures you're supposed to do, like at your level. Then additional comments. First thing is clinical performance, I think, clinical management. The second part, they're assessing under this WRIG 30 form. This is the form, communication. This is very important for us, like the international medical graduates. I think I discussed this before, like when we communicate, we should be clear and we should be raising our voice and we should be to the point, and then like we shouldn't be hesitant, right? We, as I said in a different video, we would be sometimes hesitating because of the worry that our supervisor would get crossed or something like that, but it doesn't happen here. You can tell how you feel or how you think. Oh, I'm thinking this. What do you think? Yeah. So communicate effectively with patients and their families. First thing, this is the one I mentioned, like you have to keep them happy and you have to keep them informed. And it's not like in some of our countries, you can't say, okay, I'm doctor, you're a patient, you listen to me. No, it's like a two-way communication. You always talk with your patient and then the family, and then if they agree with your plan, you execute, otherwise you change, right? Even a medication, you say, I'm going to put you on this medication. Have you taken that before? Any side effect before? Then they would say, no, I don't like this, it gives me constipation, and then you will change the medication. Something like that. You're listening to your patient and the families. This is very important practice in medicine in Australia, right? Otherwise, it can go wrong in different ways, especially in international medical graduates. If we get a complaint against us, it's mainly about communication, not about clinical medicine, mostly communication, because of some of our, how to say, we probably not aware about what our patients are expecting, what our family patients and families are expecting. It's like an open discussion, two-way communication, listening to them, and then act according to their wishes, right? Communicate effectively with patients and their families. This is very important. As I say, I can't tell you the tell you more about the importance of communication in Australia, because like you're practicing in a different country, different culture. They may be hesitant, you may be hesitant, because it's like a, how to say, it's not a familiar voice or familiar uh, accent, or it could be many things, right? Body language, a lot of things. Anyway, this is the most important thing: communication with families and friends and other colleagues. So communication, so you have to say, uh, usually this is where I can't, that's why this is very important one for the international medical graduates, because usually this is where they would say, you have issues, they don't understand you, something like that. So um, make sure that you do this. Listen to the patient, listen to the families, talk with them. I will cover a lot of the things about communication in the future, but you see, I'm dwelling on this because this is where we go wrong. Like the international medical graduates, I can confidently say this because whatever things we have heard about our colleagues or whatnot, it's more like this area. That's why even in my previous videos, I have discussed about don't be afraid, talk with them, and then tell them how you feel or what you suspect, like differential diagnosis. We don't have to keep it in. We have to tell them. We better tell them, like, okay, I'm thinking about this, but this could be this as well. Therefore, I'm working on this side. Yeah. So talking about your plans and things with families and patient. Families, of course, with patients' consent. That's why I said I will talk about communication a bit more. Anyway, this section is very important for us international medical graduates. Therefore, I'm spending some time here. Okay, communicate effectively with patients and their families. Uses interpreters when necessary. Interpreter, like if you get a Aboriginal patients, for instance, you ask the patient, like, are you comfortable with English, or you need an interpreter? Or if you get a person from a different culture, say you get a Sri Lankan patient, you just can't ask from his wife or husband, like wife or daughter, son, or grandmother, or anyone, but you always offer interpreters. And I can't remember the number now, but in you can search it in Google, and then there are online interpreters. So they would check this. Then communicate effectively with other members of the healthcare team. This is again important. As I said, when you refer patient to the medical registrar or surgical registrar, orthopedic registrar, from ED I'm talking about, or if you refer your patient to another consultant, private consultant, or like a psychiatrist, anyone, or if you talk to the radiologist over the phone to obtain a report, this is verbal communication, but sometimes, like the written communication, when you submit forms, are you filling the forms correctly? And have you put your provider number? Have you put your stamp, or have you put date and enough clinical information? Okay. You say cough, shortness of breath, and then you put some findings, and then you query, say, is it pneumonia? Is it pleurisy, query, pneumothorax, whatever, and then that sort of communication. So this is what they're assessing here: communicate effectively with other members of the healthcare team, members from outside, as well as your team, like when you present cases to your supervisor, or when you present cases to your registrar, or if you discuss things with nurses, and when you get a handover from your colleague, or when you get a handover from a GP, for instance, or when you send a referral to a GP, or when you send a letter to GP, likewise. Because the GPs sometimes, I haven't done it, but some people might sort of write to the hospital to say, oh, this guy's discharge summaries is, I don't know what he's writing. So that sort of thing. So that's not good for you. Then communicate effectively with the professional colleagues. This is what I already covered. This includes communication with general practitioners for the handover, referral, and transfers for patients. You see here, this is what I just described to you. Communicate effectively with professional colleagues, which are like GPs mainly, because you're actually sending a lot of patients back to the community as a HMO or registrar in ED, or HMO registrar in medical surgical ward or psychiatry ward or any ward, orthopedic. Here, this is why I'm stressing this again. You might get letters about you from the GPs. They might say, oh, I don't understand what this guy is talking about. He hasn't given me a plan, and he's late in his discharge summaries. And if one of the GPs crossed about it, they can complain it to the hospital. In similar vein, we can write about like good discharge summaries. If you feel like, oh, this is perfect, I'm happy about this, and then you give a good response to the team, like the ED, or if you have time, or if you feel like, okay, I have to tell this, I'm really happy, and then they can send a good review about you. Okay, so therefore this is very important. This is not like I'm the hospital doctor, they're GPs, I'm just pushing them away. If you do that, you might get something back. Then clearly document patient care, maintains complete and timely medical records and progress report. This is like it's in, as you, like what are you writing in your notes for the day or during the assessment to your patient. Like if you talk to a registrar, medical registrar, and then they told you to do this and do that, and then you document this. I have spoken with Dr. Such and such, and then so and so, and then he told me to do this, and then and then we discussed and we transferred and things like that. Meticulous documentation. This is very important. Documentation is very important in the sense, like I remember, or I'm sorry, I just reminded you before, they can complain, the patients and families or other GPs or other members of the team, like medical registrar, or someone can say, oh, this guy is not good enough when he's handing over, or when he's writing things, or when he's talking to you over the phone. But if you document what you have discussed and what their plans and what you heard from them and what's the outcome, that is there as a legal document, right? As I say, or as we know, the medical record is a legal document. So whatever you document is there for anyone to see. That's about communication. I stressed a bit more about communication because it's very important for international medical graduates. As I said, if we get a complaint against us to AHPRA or to the medical clinic or to the hospital, this is mostly about lack of communication or miscommunication or something, mainly. Yeah. And then professionalism. So you shows compassion for patients and sensitivity for their culture, ethnicity, and spiritual issues. You don't laugh at anything. I think I mentioned somewhere, or I have dealt with this, and we have seen it in AMC exams and different exams. So whether we show respect and are we sensitive enough for their culture, ethnicity, and spiritual issues, like religious practices. And some of the religions, they don't like blood transfusions and things like that. You don't question and you don't laugh at it, or you don't ridicule people or anything like that, but you work accordingly. I think you guys are aware. If not, you have to be aware that you have to respect their spiritual issues, cultural issues, ethnicity, aboriginal culture, for instance. You have to show a lot of compassion, respect, and then offer an interpreter or offer aboriginal health worker when you talk about some issues with the aboriginal people. Or I think you have heard about this in your training, you might, or in your exams, like there's things called women's business, men's business, and there are certain taboos and things like that in Aboriginal culture, so you have to be aware about those things. Then this is about professionalism, right? Exhibit high standard of moral and ethical behavior towards patients, families, and colleagues, including an awareness of appropriate doctor-patient boundaries. This is again important. You can't cross these boundaries between doctor-patient or doctors and patient families and things. And even with colleagues, so you have to show high standards of moral, ethical behavior towards patients and families and then colleagues, right? This is where confidentiality, autonomy, and all these ethical principles come into play, right? And then privacy, things like that. I can keep on talking about this, but I think we better do a different video on this, right? I will give a video with ethical practices and things with some examples. I got many examples about what we have seen or what we have done and things like that. Then able to recognize limitations in his or her practice, and request assistance when necessary, right? It's very important, again, for like doctors coming from a culture like us, like a subcontinent culture. We probably worry about our supervisor getting, not talking about, okay, I don't know this, or I'm not sure about this, and uncertainty about diagnosis and things. It's perfectly okay in an Australian setting to talk about this. Like, okay, I have read about this, but I'm not sure. Yeah, things like that. You could always talk about that if you know your limitation. If you don't know, or if you can't do, for instance, a procedure, you don't go and do it, but you tell your supervisor, okay, I have tried this, or even a cannulation. If you tried a few times and if you're failing 2, 3, you don't put the patient in discomfort. You go and talk to the supervisor and say, okay, I tried this this many times, but no luck, and then they will help you. Then you show honesty at all times in their work. put patients' welfare ahead of personal consideration and accept responsibility for own actions. This is where, like, if you're about to go home, but there's something urgent is happening, so you might spare a few minutes to sort of settle that or hand over that to someone. These sort of scenarios you will come across in your exams, right? So you should be honest. So you don't lie. You don't say things like anything you haven't done. You say, I have not done this. We need to do this. Yeah. Okay. Know the limits of own competence and functions within those capabilities. Seek advice and assistance when appropriate and accept feedback. This sort of thing. Yeah, I think we can keep on talking about this. Shows resourceful attitude towards continuing education to enhance quality of care. Participate actively in CPD program. This, when I say I can give you examples, this sort of thing is like you get weekly, like, you know, M&M meeting, mortality and morbidity meetings, or meetings between teams and things like that. I remember when I was even an observer in the Bendigo Health, I used to go for all these meetings every week. So they are very good resource for your education, your practice, and to discuss with colleagues and get an idea about how the colleagues sort of acting in a team and things like that. CPD is very important. Like, so this one, supervisors, they might have put me in the top because I was always there. Yeah. Resourceful attitude towards continuing education and enhance quality of care. Participate actively in CPD programs. Yeah. Safe practice. Australia, it's very, very important that you practice medicine in a safe way. This is very crucial in your practice, and then they look for whether you do it safe way. So here, safe practice demonstrate knowledge of common therapeutic agent uses, dosages, adverse effects, and potential drug interactions, and ability to prescribe safely. This is like knowing, like when you prescribe something for a patient with a renal failure, is it okay? Yeah, you know, like if it's a medication affecting the kidneys or livers. If, for instance, if you've got a patient with a liver disease, you won't be prescribing, say, augmentin or Flucox, things like that. Or like reduce renal function, you change the medication dose. These are things the pharmacists are very comfortable with, like a lot of like clinical pharmacists. They know a lot of things about these things. You could always talk with your pharmacist. Pharmacists, like in ED and different wards, there are ward pharmacists, or in emergency department, there is an emergency department pharmacist. In community, you always got community pharmacists as a GP. You can discuss with them always with over the phone or page them and things like that. And then you always be comfortable with PBS website. And I think I mentioned it in a different video. And then knowing like therapeutic drug level monitoring, for instance, lithium, then lithium is one thing, then another thing is gentamicin, and those sort of medication, checking levels before you go, or like, you know, like there's so many medication, I can give you examples, but you should be aware that it's not like your home country. For instance, here it's checked, and the pharmacist would suggest you. Even now, the pharmacist suggest us sometimes, they on this medication, have you checked that level? So you should be aware about that. That's very important things in your form. If you say, for instance, if in your form, if you say sometimes perform below the level of expected in this column, it doesn't go well, because it's a very important thing in your practice, right? You should be comfortable with different medication dosages and adverse effects and drug interactions and so on. And then demonstrate knowledge of infection control principles, safe practice in relation to blood-borne infection in patient care. So whether you use gloves, masks, wash your hands, and put the sharps into the sharp bin, and infected material into the yellow bin, and things like that. Okay, you will get to know this when you come to work in different units. And then recognizes correctly and report adverse incidents in timely manner. If you had some adverse effects, some event, there are sort of ways of communicating with the team. You always talk to the supervisor, and this happened, that happened, and then you don't hide things, but you go and tell them, okay, this mistake happened, and things like that. Okay, people do mistakes, but you have to tell them. Yeah, then list the issues addressed and how will be addressed. If there's issues found in the top columns, then what's the plan? Then recommendation. This bit is important. Is the IMG suitable for ongoing registration? And do you recommend a change in IMG level of supervision? Sometimes they will take the level of supervision from 3 to 2 or 1, like close supervision, that sort of thing. And signatures, and send it. Okay, this is the form. Sorry, I'm going up and down of the form just to get the first part of the form. Work performance report, WRIG 30. This is critically important for international medical graduates. This is the critical form. They send it at the 3 months period of your registration. How to say, is it do or die, or like that sort of scenario? Let's stop. I think we spend some time. That's why I just don't like to go to the other form. Otherwise, I can go through the Bendigo Health form quickly. But I think, yeah, is it a good idea? I'm just thinking. Maybe next time, or okay, that's the form. Yeah, that's the Bendigo Health form. So they got HMO assessment. This was 2014 when I did it. Yeah. So they got midterm assessment and end of term assessment, as I said. And then the assessment again about clinical management, communications, and professionalism. Then they talk about documenting, defines clinical problems, develop an appropriate care management. And yeah, so you can go through. Demonstrate knowledge of infection control, recognizes and correctly reports adverse incidents. These were there in the AHPRA form as well. Plans for discharge of patients, including documenting discharge summaries. Again, they put not able to observe, or there are different categories here, but then they will tick and recommend. So you say some comments from the supervisor and some comments from the HMO. This is a HMO form assessment. Communicate here, communication, we can read it through. Communicate effectively with the patients and their families, just very similar to AHPRA. Communicate effectively with other members of the healthcare team, again AHPRA form. Communicate effectively with professional colleagues, including GPs, for handover, referral, and transfer of patient. As I said, this is important. You can't just disregard GPs. GPs, I'm just sending a form, but they can feed it back to your supervisor to say, okay, I'm not happy about your colleague's discharge summary. It doesn't make sense for me. Okay, and then that doesn't go well for you. Likewise, they can tell, I got a perfect discharge summary. I remember one of our GPs in our team recently received a comment from the Bendigo Hospital to say he's doing perfect referral letters for us. So something like that. Professionalism again shows compassion for patients and sensitivity to their culture, ethnicity, and spiritual issues. This is like religious practices, cultural practices, hobbies, and things like that. So you have to be aware about that. Okay. I think this is enough info. I have sort of pull out the AHPRA form as well as an example from a hospital form about these assessments. When I say this, you get 2 assessments from the hospital, 6 weeks, 12 weeks mark, and then 1 assessment at 3 months mark, again 12 weeks mark to the AHPRA. That AHPRA form is critical. So as the hospital assessment, if you fail in one of these, you won't be continuing, right? Okay. I'll stop sharing because you come to my screen. Sorry, guys, I took some time, but I think it's critically important for you guys what I was talking about, your assessment, which is going to AHPRA at the 3 months period. At that time, they decide whether they continue you with the same level or whether they suggest you to do a extra supervision or extra bit of training or things like that. That's why it's very important to aware about this form. I think it's helpful for you guys. If you find this helpful, please share it with your colleagues, and then please remember to subscribe and press bell icon so that you can receive this sort of videos again. Thanks, guys. Have a good one.